Have in the first round of bidding process, a Texas-based supplier won a bid that serviced Charlotte, North Carolina, a Texas-based company. How does CMS evaluate the bidder statement of capacity when the provider has no offices, no employees in Charlotte?
A very good question. Consistent with how the Medicare program currently works, there are providers that operate out of state and move into new areas. Some suppliers are setting up subcontracting arrangements. Some may have distribution centers on the ground. Just yesterday, we talked to two suppliers that were moving into Pittsburgh. They already had, while they're listed in another state, they already had a distribution center on the ground. One of them already had existing contracts with the University of Pittsburgh Medical Center and had been supplying services through W-2 employees in Pittsburgh for years. So we think there are a lot of those type of arrangements being made. We're checking on these ones that are listed as out-of-state suppliers because we think the issue you raised is an important issue. We want to make sure that the suppliers have a plan in place to provide services, provide access to our beneficiaries. And in fact, through the bid process, we did ask for subcontracting information from suppliers because we wanted to understand their expansion plans and know how they were going to provide services. And we're following through to check on it now.
During the process, obviously one of the qualifications was their quality. How was, specifically tell me how the quality is measured from a particular company?
What the law requires, the Medicare Modernization Act provided this authority that CMS would establish a set of quality standards that independent accreditation organizations selected by the Secretary would use to go out, do on-site reviews, and accredit suppliers. So suppliers need to have a plan for things like business standards, personnel, but also how to provide care, that is working with physicians, how they're going to do delivery, setup of equipment, how they're going to monitor complaints, collect performance information, and keep that information for the accreditation organizations. So we expect and require for this program, and will require nationally by September 30th for all suppliers, September 30th, 2009, that they be accredited in this manner. There are 10 private accreditation organizations currently accrediting suppliers.
So you looked at the quality based upon the business. What about, I've been in business for many years, and occasionally we have subcontracted. How is a business to be able to regulate, or how does CMS how are they qualifying a subcontractor of a company? I mean, if they're looking at quality based on that company, when in fact the supplier themselves is actually another company. If they're subcontracting it, what qualifications from the subcontracting has CMS taken in consideration?
Right now, we hold the supplier that we have a contract with responsible for meeting the requirements and ensuring that the beneficiaries are provided the appropriate services. Do we have an accreditation requirement on the subcontracting suppliers? I don't think we have that requirement in place right now. I think that's something that we need to look at as we roll out accreditation nationally for September of 2009. I think that's an important issue because to the extent that suppliers have been subcontracting, and they have been for years, and we are moving into this world of accreditation, we need to consider what that relationship looks like. So I think it's an issue and one that we're looking at in the context of our progress on accreditation.
So in fact, a company could be awarded a bid through the process. They could be rewarded that contract, and they could subcontract out to someone who was of substandard that you had actually already failed or denied.
If they had failed accreditation, I think that would be a concern for us.
So maybe that's something that CMS should take in consideration?
Well, I think that's something we ought to look at, and to the extent that we are interested in looking at subcontractor relationships and accreditation for all suppliers.
Would the gentleman yield?
I yield to the Chairwoman.
Mr. Wilson, the subcontractors, will they be licensed by the state? Will that be required to be licensed by the state in which they are going to be providing the services?
I'm not sure of the answer to that question.
Don't you think that is an important answer?
I think it's an important answer.
Because it will determine whether or not they have the ability to provide quality care and services.
I think we should do everything that we can to ensure that the beneficiaries get the services they deserve and that they're quality services.
So what process are you going to have in place in order to make sure that the appropriate oversight will be there to prevent those subcontractors that do not have the ability in the first place because probably they submitted a bid and they fail. So if they fail, what do you think are the reasons for someone who submitted a bid and failing in not getting the award?
I think to the first part of that question, what we need to do is rely very heavily on monitoring, especially as we roll out the program on July 1. I think we need to do things like collect data from 1-800-Medicare. We're doing that. We need to do beneficiary satisfaction surveys to ensure that people are happy with the services they're getting.
Okay.
I think you raise an issue that we may want to focus on in doing that type of review. We are also operating a program where if there are concerns, they do arise, we will have ombudsmen. We have 8 ombudsmen ready to work with beneficiaries and suppliers in each of the areas, or 8 ombudsmen total that will be out there. And so I think we need to be able to address those types of concerns.
Mr. Wilson, when I ask you the question whether or not licensing is an important requirement, you say that you don't know the answer to that question. Isn't that part of the Medicare rule, that license?
I believe it is. They need to have a National Supplier Clearinghouse number, so they need to be enrolled with us. And to the extent that the state requires licensure, which I believe it does, then whatever the requirements are for Medicare enrollment, they must be met by the supplier.
I yield back. Thank you.
If obviously we've indicated already a few of the many concerns and questions that that the committee has.